Welcome to Trifecta Collective, Finding the Root with Megan and Shannon, the podcast, where we dive deep into all things health and wellness to help you find health and healing inside and out for now and forever.
Hello and welcome to Trifecta Collective, Finding the Root. I am Megan Abbott, owner and founder of the holistic health practice, Trifecta Collective. And today it's just me. And what we're going to be talking about today is mast cells and histamine issues. And this is I'm recording this not too long after we did the mold, mast cells, and histamines webinar and masterclass that went super well. If you missed it, it is no longer free. We are offering it. It's about 2 hours, just over 2 hours worth of information here. We're going to be selling this for just $11, just a really low tier offer if you want access, but we did say it was not going to be free after the fact, unfortunately, because there was so much time and effort and the level of education that went into creating this course was pretty significant. So very low cost. And there is so much information. I do give like some really specific protocol recommendations, testing information, like all that kind of stuff that I'm not going to be going over today from a mold standpoint. I'm really just going to be focusing on mast cells and histamines. And, for me, my passion came from this from a point of, especially right now, I am seeing a massive influx of information and people talking about histamine issues, which one, I am super glad to see and really excited that this is becoming a more popular topic because I think it impacts so many people. And I personally, I would say I suffered from mast cell issues, although kind of question mark kind of in there in the heat of my journey. And this was something no one ever mentioned to me. It's something I learned really more as I was going through my mold education, where mast cells was really talked about a whole lot more in certain courses, certainly not in all of them, which I think is a huge mistake if you're not talking about mast cell issues when you're talking about mold. Huge disservice because mast cell issues are pretty much always an issue when it comes to mold. It's just really the level of issues that we're really dealing with. So the histamine piece, though, is something I personally really struggled with. I was on allergy medication forever. The weaning off process was extremely challenging and very difficult to do. I'll also say that mold was not my root cause of histamine issues. My immune system, and if we kind of did, generally speaking, the immune system was my issue. And if we dig a little bit deeper into that, we can say trauma, nervous system dysregulation, heavy metal overload, and parasite overload were my big root causes for my histamine issues. And that can certainly be the case for a lot of people. And mold does play a really big role in this. So I am going to touch on that piece here, but I really want to dive into more of the mast cell and histamine piece. And I'm going to start with mast cells because mast cell dysregulation issues often lead to histamine issues. And with the amount of people talking about histamine issues right now, it's very frustrating for me at times with just knowing everything that I know and having so much practical experience. We've worked with hundreds and hundreds of clients over the years with mold, mast cell, and or histamine type issues. They are some of the most common issues, especially right now over the last probably 2 years within our practice. And once again, just the level of practical experience along with all of my educational background, it's very frustrating for some people who we'll just say it politely, don't quite have the same level of experience, whether that's education and or practical experience from this. So I want to dive deeper into this and help explain really where a lot of the gaps that I'm seeing when it comes to this kind of stuff happen. And I also want to acknowledge that, sometimes And this is something that I'm very passionate about and have always been very passionate about when it came to creating the practice and streams of revenue and all that kind of stuff. And I don't think this is necessarily a bad thing, and I would encourage you to be aware. So a lot of these people that are talking about a lot of the histamine issues have their own supplement brands that they own and sell from and obviously make a profit. And once again, not a bad thing. But there are a lot of people who have this and a lot of people who are coming out now with rebranding. And a lot of times what happens is there's a relabeling process of pretty common supplements in this space that people can relabel under their own name and then sell. And they can make money off of that. And once again, not necessarily a bad thing. It's something that I'm pretty against. By and large, if there was if there was really something on the market that I felt like was missing, this would be a little bit of a different story. But especially when it comes to the histamine-based products, I think there's a lot of people just trying to sell supplements and keep people on supplements long term because they're symptom managing histamine issues and histamine symptoms versus looking at the bigger picture into understanding why and how these things are happening, and then how do we support the body in a variety of ways, because I also think there's a lot of different ways to do this to help the body heal. So let's start by diving into more of the mast cell issues here first, because once again, I think this is going to lead more into the histamine piece, and I will probably spend more time on the histamine piece just because I think that it's becoming so popular that I want to make sure I give that piece the time and detail that I would really like to give it. So mast cell issue. So let's really strip this down. What are mast cells? So we all have mast cells. There is a very, very, very small percentage of people who don't, and it is a genetic issue. And I can tell you that you would know pretty much right away, and you would have been diagnosed at a very, very young age if you were born without mast cells, because they're so prominent in the body and they're so important. They do so many things. So if you don't know, you have them. So almost everyone has mast cells, and mast cells are, at the most basic level, they are immune cells. So they're a type of white blood cell. So they're specialized immune cells. They are located almost throughout our entire body, which I'm going to dig into this a little bit more so we can start to understand a lot of mast cell symptoms and why this can be very challenging to get a more formal diagnosis. And I'm also going to talk about that piece too, because I have a lot of feelings, and I've worked with a lot of people who have gone through the official diagnosis process and have largely regretted it because of the challenges with it. So I am going to talk about that too. But yeah, mast cells are really located throughout our entire body. And the important thing to understand is because they are immune cells, they are triggered by stress. And I'm going to leave it there for this moment, but I am going to come back around to this concept of stress because I think this is really, really important to understand. And I know I talk about this on certain types of platforms and during certain conversations. And this is definitely one of the conversations where I think it's very worthwhile to dig into this again. But I want to dive first into the location and kind of more of the specific roles of mast cells here first, so we can get a better understanding of why mast cell issues can become so systemically dysregulating, to say it really nicely. So the first big place that we'll often see mast cells located are mucosal and the lining tissues. So those are things like the nose, the sinuses, eyes, mouth, all throughout your digestive tract, your lungs, and your bladder. So I'm going to go through a couple of symptoms here kind of as we go along. And I'm also going to do a little bit larger rundown, a quick rundown of a list of common mast cell symptoms. And they are, once again, pretty widespread here. But because mast cells are located in all of these mucosal linings and tissue linings, this alone can present as pretty systemic and seemingly random issues. So no sinuses, we think about histamine issues for sure, and I'll talk about the connection here, but sinus pressure, sinus congestion, a lot of postnasal drip, just a lot of congestion, sneezing, sinus headaches, all that kind of stuff. Eyes dry, watery eyes, eyes that produce just like are really strained almost all of the time. I've also worked with a handful of people. This is not a ton of people, but a handful of people with some like weirder, meaning they're just not super common eye issues. And these have been more degenerative kind of eye issues where certain pieces of the eye, especially like behind the eye, there's a lot of pressure. There can be a lot of fluid build up behind there, just putting a lot of pressure on the eyes. And very fortunately, we've been able to reverse a lot of this and or stop progression. So much so that I had one client where we were able to do this. She had so much fluid buildup behind her eye that they were getting ready to do a spinal tap to drain the fluid because it was impacting her body so much. And we were able to avoid that and not have to go through that kind of procedure, which can be very, very painful. And no one wants needles stuck in their spine. So that, not saying that would be the case for everyone. And we have seen that on a handful of occasions of some people coming in with some more unusual kind of eye issues, and we've been able to reverse them and or stop the progression, which is obviously amazing. And eyesight is a hugely important thing, and being able to maintain our eye health, super valuable and super important here. If we think about the mouth, so the mouth, we can see things like sores, like mouth sores, I would say would be some of the most common. We can also see, and this isn't specifically mast cell related, but a lot of times we'll end up with like thrush and oral kind of issues, like the white coating on the tongue, potentially like even white sores, white pockets throughout the entire mouth and the tongue. And just painful, just almost like seemingly like very painful, very sensitive mouths and or tongues. We'll throw the tongue in there too, because I've seen that a lot too. Digestive tract, obviously all kinds of digestive issues we can end up with, lungs, breathing issues, all kinds of breathing issues, feeling like you can't take a full and deep breath. And now their digestion can also play a role in this, especially if we have a lot of like SIBO type issues. If we're very constipated, this can definitely contribute as well, but so can just mast cell issues, because it's going to impact, if you release all of your bowels really early, sometimes this will be the case if you have what would be considered like very fast motility, extra fast motility, leaky gut kind of issues, because that's a whole of the mucosal lining of your small intestine. So we can end up with all kinds of digestive issues here. And the bladder, UTIs can be rooted in more yeast fungal type issues too. IC, interstitial cystitis, can definitely see an overactive bladder, just some bladder discomfort, painful urination, just a lot of discomfort when trying to urinate, frequent urination, also not uncommon. So the mast cells can impact all of those things. Mast cells are also located in our blood vessels and cardiovascular tissues. So the heart palpitations is one of the most common mast cell issues. It can also be in your veins, your capillaries, your arteries, and we can see all kinds of a variety of issues among these areas. Connective tissues and tendons, ligaments, bones, and joints. So connective tissue disorders, things like hypermobility, EDS, Ehlers-Danlos syndrome, not uncommon at all when it comes to especially significant mast cell issues. Lymphatic system, so all kinds of swollenness in your glands, not uncommon. This can be, and keep in mind, you have a lot of glands in your face and neck, in your armpits, right around your breast tissue, especially women. We see a lot of issues and inflammation right around their breast, even denser breast tissue as a result of this, that then subsides after we've gone through the healing process. And then there's quite a few in your groin as well. And we can see just like pain and discomfort around the groin. That's not necessarily groin related, but it's from these lymph nodes kind of around the groin area. And we can end up with a lot of drainage type issues because the lymphatic system does a lot with drainage, among other things as well here. So that can be a huge, huge thing. The skin. Skin issues are another one of those things where is a very, very common symptom when it comes to mast cell issues. And this might be rashes, hives, eczema, psoriasis, itching skin. One of the most common ones that I often tell people, and people be like, I've told so many people of this symptom and they all think I'm crazy, but almost feeling like you're itchy on the inside, but you go to scratch and there's nothing visible on the skin, and almost feel like there's like bugs crawling on you or inside of you or under your skin, that there's definitely not anything there and you're still just really, really itchy. So that is a very common thing. We can also see a lot of issues with acne. Now, acne also has a variety of root causes. So just because you have acne does not mean you have mast cell issues. So this is also another thing. It's because these issues are so widespread, we have to dig into understanding why and what is going on, because a lot of these symptoms do overlap, and we do understand that. And also say from a marketing perspective, we do get a handful, I wouldn't say a ton, but a handful of comments on a variety of videos, especially when we list symptoms of like, well, I have all of the things because I have all of these symptoms. And it's like, no. And a lot of symptoms overlap, and a lot of symptoms also overlap because if you're symptom managing and looking at bigger root causes, well, these bigger root causes often cause similar issues and varieties of dysfunction within the body that present very, very similar, which is where working with someone on the bigger approach, like root cause approach, which is what we do, can go such a long way in actually being able to heal. And then, as we always say, more importantly, staying healed long term. You also have mast cells in your hair follicles. This is another one, and this is an interesting one. My partner who's going through chemo, his hair has started to hurt. He shaves his head and has shaved his head for a little while now, but he's like, my hair follicles hurt. And, for me, the first thing I immediately think of is mast cell issues. It's not. His hair is getting ready. He's starting to lose some of his hair. Not that he has a ton to begin with, but on his head. So, but that's always the immediate thing that I think of whenever he says like my hair follicle. It feels like my hair follicles hurt. Like, well, that is a very common mast cell issue, but not necessarily in your case because he's getting ready to lose his hair as a side effect of the chemo here. But feeling like your hair follicles hurt, like feeling like your hair hurts, is another pretty common one that can seem a little outrageous. And you can tell a lot of people and they can really just look at you like you're crazy. And you're not, because there are mast cells in your hair follicles. So once again, not uncommon to see this. And then the last big place we'll see mast cells are in the nerves and nerve tissues, and then in the brain. So if we think about mast cells in your nerves, nerve pain, all kinds of nerve pain. And once again, especially as a personal trainer, I dealt with a lot of chronic pain type issues because I specialized in that for several years. And nerve pain can be, nerves being blocked. It can be structural kind of issues going on. I personally dealt with sciatica issues for many, many years. I lost feeling in my right leg. And then when the feeling did come back, it was terribly painful and very uncomfortable. And sciatica was something I struggled with for a very long time before I figured out my root causes and how to fix those. And those were both inside and outside of my body. But a lot of nerve issues, nerve pain, feeling just certain nerves are very, very sensitive. It is often kind of the way it's described to me, but that is not uncommon. And then mast cells are in the brain. So of course, we're going to see cognitive issues, trouble focusing, trouble concentrating, trouble with memory, trouble with recall, all those kind of things that, it can present similar to ADD or ADHD. And yes, I believe that is a real thing. And I also believe that many people are misdiagnosed because I've seen it. And I've seen people be diagnosed with ADD and or ADHD, and then we do a lot of the work and they no longer have any of those symptoms anymore. And it was because of mast cell, typically mast cell and or toxin overload issues going on here that we were able to address and help their bodies heal so that they no longer have those. And that is not the case for everyone, because I have worked with enough people at this point that I do firmly believe in that. So just a little side note there, but I think it is overdiagnosed, especially in the adult population right now. The other piece of the brain is neurotransmitter production and or transportation. And because both the gut and the brain can be impacted here, we will often see a lot of mental and emotional struggles when it comes to mast cell issues. I would say anxiety is probably a little bit more common, and that doesn't mean depression and OCD. Some of these other things can also present because I do also see all of those things. I would say anxiety is probably just the most prominent one that we will often see within our practice when it comes to clients with mast cell issues. So when we look at those are where mast cells are located. Now, what are the roles of mast cells? Now, I've already talked a little bit about a couple of these, but there's a couple that other ones that I do want to go through that may explain a few other symptoms that you may be experiencing with mast cell issues. So obviously, because mast cells are immune cells, they play a big role in our immune system. And most of our immune system is housed in our gut, about 70 to 80%, depending on who you talk to. And so if our gut's already impacted and then our immune system is impacted, obviously we're going to have all kinds of immune issues. And this can go kind of both ways. One, you can get sick very, very often. Now, I've also seen people, especially people over supplementing with vitamin D. Go listen to our blood testing part 2 episode if you want to dig more into that vitamin D piece. But over supplementing with vitamin D can heighten your immune system. And so you can feel better and you can almost never get sick. And that is also not necessarily a good thing. If you were never ever getting sick, that is also showing us some things going on in your body that aren't quite right. Now you also should not be getting sick, every month, every other month, like 5 or 6 times a year. I'd say once or twice is pretty standard, pretty normal for the average person, especially, if you have kids, young kids, maybe a little bit more as a starting point, but still it shouldn't be crazy, but we can definitely see immune function issues. Wound healing and tissue repair. So if you get a cut or a scrape, you might have trouble healing, or it might take you a really long time for it to heal. Maybe you're left with a scar that seems to be maybe a little bit more exaggerated than it should be, quote unquote, it should be, based on the level of the injury. So that can play a big role. The other thing we can see, and this is where sometimes iron issues can come into play, and people can come in and be like, oh, I just bruise really easily, and it's because of my iron levels. Maybe that could be playing a role, and we'll often see people with mast cell issues have a hard time wound healing, and we'll often end up with a lot more bruising, and the bruising lasts for a longer period of time. So once again, we have to look at the bigger picture. We also need to look at tests. We need to look at lab tests to understand more as to what is really going on, why is it going on, how is it going on, what are the bigger things that we need to address here. Defending us from infections. Once again, you can get sick and sick very often. This is, once again, like one of the more common symptoms that we'll see is just getting sick a lot throughout the year. Building connective tissue. Joint pain is a really big one that can come along with this. I'd say joint and or muscle pain. I'd say joint pain probably a little bit more common. Brain cognitive function issues. So once again, we can end up with those kinds of issues. Mast cells also create new brain cells. So if we think about learning something new, trying to brain rewire, retrain our brain, things like that can be very, very challenging if we're not creating these new brain cells because we've got mast cell issues. So it can be making it very challenging. And a question I get a lot is, I just had a conversation with one of my personal clients here earlier this week. And, if we have all of these issues and our nervous system is dysregulated, do we need to do the nervous system regulation first? Or do we need to do the other work first? And my answer is neither. We have to do both at the same time. And a big reason, especially with chronically ill people, especially with a lot of people with mast cell issues, is that our nervous system, when our nervous system is dysregulated, we can end up with all kinds of stuff patterns and all of these issues. And yes, like we have to regulate our nervous system to be able to heal. And if we don't do the physical work to help stabilize our body, to help it heal internally and physically, it can also be impossible to regulate our nervous system. And so it's a catch-22 of which one do you do first? It's neither. You have to do both at the same time. Otherwise, what I have seen in my personal experience has been, once again, it's very challenging to heal, fully heal, and stay healed long-term if you're not doing both. And mast cell issues can play a really, really big role in this. And the last big one I wanted to mention is, for the women, regulating our menstrual cycles. And when we get to the histamine piece, I'm going to dive deeper into this because once again, I'm seeing a lot. We're getting a lot of questions. I'm seeing a lot of misinformation in regards to hormones and histamines. And once again, I think it's important to understand. So mast cells, one of their big roles is to regulate our menstrual cycles. So when we have menstrual cycle issues, it can, at least in part, not for everyone and for many people, be mast cell related. So if we only look at specific hormones, we're missing the bigger picture here, because if mast cells are playing a role, you can supplement, you can do all of the things, you can supplement with all this stuff, you can do HRT, BHRT, all of these things, and you may never see real long-lasting shifts in your hormones and in your menstrual cycles, and it can be mast cell related. Something to think about here, and this is a very, very common misunderstanding. So I'm going to go through a very quick rundown of mast cell symptoms that we will often see. And many of these I've already mentioned, some of which I have not. And I also, once again, I just want to acknowledge, just because you have a couple of these symptoms does not necessarily indicate that you have a mast cell issue. And if you do have a handful of these symptoms, it is absolutely worthwhile to dig a little bit deeper into the mast cell piece here and understanding that piece, and if that piece is playing a role with you and your body so that you can properly support your body throughout the healing process. So here we go. Sinus pressure, sinus headaches, any sort of sinus issues, hives, rashes, sneezing, congestion, postnasal drip, any sort of this like nose, sinus, congestion, all of that kind of stuff. Swelling, and this can be just generalized swelling. Hands and feet, I'd say, are most common, and that is not necessarily the only places. All kinds of cognitive issues, joint pain, hypermobility issues, fatigue, inflammatory issues. This is a big one too. Sensitivities to things, I'm just going to say across the board. I am going to list a handful of these. But this is a really common one too. So sensitivities to smells, light, being around a lot of people, supplements, medications, EMFs. I've had many people come to us saying that you're going to think I'm crazy, but anytime I get close to a router or around a cell phone tower, it feels like I'm buzzing on the inside. It's an EMF sensitivity. Heat, sun, and or other environmental factors, all kinds of food sensitivities, muscle and or joint pain. Osteoporosis is a big one here. And once again, I think there's a lot of other factors for many people when it comes to osteopenia and or osteoporosis. Flushing, also say like redness, like getting really bright red and or flushing, and kind of depending on where you flush, it may be more just presenting as bright red versus if we think about flushing in the face, usually it's going to be more cheek kind of area, and then our lips will kind of stay the same color, which would indicate more flushing. Hair loss, also say hair thinning, hair being really brittle, things like that. Skin issues, eczema, psoriasis, along with the rashes and the hives and or acne. Chest pain and or heart palpitations. Fainting and or dysautonomia type issues, including POTS. This is another pretty big one with people with more significant mast cell issues. We are commonly going to come with some dysautonomia issues. constipation and or diarrhea, acid reflux and or heartburn, abdominal pain, abdominal cramping, all of those kind of digestive GI related kind of things. Headaches or migraines is another really common one. Tinnitus, so ringing in your ears, super, super common. Mental health struggles, anxiety, depression, OCD, things like that, shortness of breath and or asthma. Once again, asthma can have many root causes. Just because you have asthma doesn't mean you have mast cell issues. And it's not uncommon to be very short of breath oftentimes. Once again, that feeling of you can't take a full and deep breath and or a full-on asthma attack. Painful periods and overall hormone imbalances just across the board. Once again, I'm going to dive a little bit deeper into that. Urinary tract issues, including pain and or UTIs, nausea, vomiting, rapid changes in blood pressure that can go either way. I'll say more commonly it comes down versus up, and I've seen it go up plenty of times for all kinds of stuff. And when we think about high blood pressure, we'll often look at minerals and mineral balancing first. That is often a big root cause, and we need to look at stress, of course, coming along with nutrition and all that kind of stuff. So before I dive into how mast cells and histamine are related, I want to talk about two things. So one is testing for mast cell activation syndrome, or MCAS. So when your mast cells become chronically dysregulated, we can end up with a quote unquote disorder called mast cell activation syndrome, meaning that your mast cells are chronically activated and are turned on, which is not what they're supposed to do. They're supposed to turn on when they're supposed to, when the timing is right, and then they're supposed to turn off when they're supposed to for a period of time. And the issue with mast cells really comes into play is when our mast cells become chronically dysregulated and are turned on. This is really across the board when we see these issues. So, we think about nervous system regulation issues, dysregulation issues. We have these coping patterns and specific patterns, fight, flight, freeze, fawn, that are normal and natural. And that is what our body is supposed to do. And the issue comes into place when our body gets stuck there and can't kind of flow in and out of the parasympathetic into the sympathetic state. And it's really similar with mast cell issues. We're supposed to kind of be able to flow in and out of these states where they turn on when they're supposed to, and then they turn off when they're supposed to. But when they turn on chronically, when we talk about stress, and I'm going to get it, that's the other thing I want to talk about before I dive into the histamine piece, this is where the issue really comes into play. And so in order to test for MCAS and kind of get a more official diagnosis, typically I'll recommend going either to an allergist or some sort of immune specialist. Not all of them will test. I'll tell you, not even all of them know what mast cell issues are and or what MCAS is. So do some research, do your due diligence before scheduling an appointment, and also recognize that, especially with these more specialized types of people, you're going to wait a good amount of time usually to get an appointment with them, let alone to be able to test for this. So there are some blood markers that can be run. However, it's not always super accurate, and you have to be in a very, very active flare to test positive. And I've had several people go through the process to get properly tested and get the official diagnosis because it was very important to them, which I totally get, totally understand. And it was so miserable, and they almost always regretted it because the support that they're getting afterwards is not great, and the amount of pain and discomfort they had to go through to get the diagnosis was significant, to say the least, and lasted for a significant period of time. So you have to be in an active flare, meaning you have to purposely put yourself into a flare, and that can be a variety of things. You also have to be off all antihistamines, any sort of immune modulators, which can also be very uncomfortable for many people when you have mast cell issues. So keep that in mind. And usually you have to be off of those for at least 7 to 14 days. And then once again, put yourself in an active flare to be properly tested. And once again, the testing is not super accurate always, in my personal opinion, and I fully support if someone's really passionate about getting this diagnosis, I'm totally on board with that and happy to support before, during, and after this process. And, the medications that they'll often get don't do a whole lot. And so often it's not worthwhile. So that is something to think about. It's not something we do in our practice because once again, it's a symptom. I can tell if someone has mast cell issues just by talking to them. And then we can see, chronic inflammatory issues and other things like that in blood work, among other testing. So we personally don't test. I'm not a huge fan of testing. Just in my opinion, it's not usually worth the cost that it takes. And I'm not talking monetarily cost. I'm talking for you to go through that process. And then usually it takes anywhere between 2 to 4 weeks to recover from that too. So, you're putting yourself out for potentially like a month and a half, depending on you and your body and all that kind of stuff. And once again, if someone wants to do it, fully support that process. And typically it's not something we will openly recommend because mast cell issues are a symptom. So that's what testing usually looks like. Now, let's talk about the stress piece here, because once again, I think there's just a lot of misconceptions about stress. And when people talk about stress and all the things when it comes to stress, we think about external stresses. A great example in my own life right now, my partner, this person that I love so much, has cancer and is going through chemo to destroy his body. And it's a lot. And understandably, there's no control over this. It happened, and we're going through the process. He's responding really well, which is very fortunate, and great to hear. His last PET scan was awesome, which is so good. And at the same time, he's still going through 12 rounds of chemotherapy and all of the side effects and all of the things that kind of come along with that. That's physical, mental, emotional, all that kind of stuff. And so stress is high, and that is a non-controllable. I have zero control over that. There is nothing we can do. We are doing everything in our power to support him, to support me, to support this whole situation. And it's just a stressful situation. And here's the thing. Stressful situations happen, and they're always going to happen. There are so many uncontrollables in life. And so for me, when I think about stress and how to manage stress, and one of the things that has helped me so much, especially with all of my chronic issues, and if you know my story, I spent years and years and years trying to regulate cortisol levels. The level of trauma I've been through is pretty high. And so regulating my nervous system has been a whole process and continues to be a process and something that I really focus on. And that gives me more capacity for stress. And when we think about stress, I like the analogy of a stress bucket. So let's talk about, what are things that can be stressful inside and outside of the body? So obviously uncontrollable situations. I would throw some controllable situations in here that just cause extra stress, and then once again, some of these are controllable, some of them are not controllable, and uncontrollable stressors, external stressors, are going to happen throughout our entire life. And so it's how do we set ourselves up to be able to handle that, for our bodies to be able to handle that and not go into these crazy flares of any sort, whether that's, autoimmune, eczema, psoriasis flares, mast cell flares, cortisol flares, whatever it may be. How do we make sure that our body doesn't go through that? And we need to look at the total stress picture. And we do have a lot of control over a lot of these stressors. So we have external stressors. We talk about basic internal stressors, nutrient deficiencies, eating a lot of inflammatory foods, and that super depends on the person. And I'm not talking, let's eat 100% paleo or Whole30 all of the time because it's super anti-inflammatory. No, I also think that can be a stressor in and of itself, which is why we don't typically recommend elimination diets or restrictive dieting within our practice. And we also do need to look at food and food quality and making sure we're getting, a couple of big things I always look at. Are we getting enough calories? Are we eating too many calories potentially? Are we getting enough essential nutrients? Proteins and fats are essential. Carbohydrates technically are not. And especially for many people, especially for menstruating women, we need some carbs. I find most people do much better with carbs than without. And without carbs can be quite stressful. I'd say postmenopausal women, little different. And sometimes we'll see a lower carbohydrate diet actually be a little bit more supportive and a little bit more anti-inflammatory. So all of that, all of the chemicals in food, are you cooking all of your food in plastic and on Teflon? Like what about toxin levels, toxin exposure? Do you live in a place with a bunch of mold? What about heavy metal levels? Are you using a bunch of things where you're being exposed to heavy metals? What about all the endocrine disruptors in skincare products and beauty products? Are we being exposed to that? All of that is very stressful on the body. Are we getting enough sleep? And once again, that super depends on the person. For me, I like a good 8 to 9 hours. I can do okay with 7, and my body very much prefers 8 to 9. Are we getting quality sleep? Are we breathing appropriately and enough? If a lot of people who are under a lot of stress, we are chest breathing and not breathing fully and deeply and getting the level of oxygen that we really need. And that is a stressor. Are we drinking enough water? Are we getting some natural light in our eyes? Are we sitting all day, every day? What is your history of antibiotic use? How many medications are you on? How many supplements are you on? Keep in mind, all supplements and medications have to go through the liver. What other kind of stress are we putting on the liver? Are we drinking a lot? What are our coping mechanisms? Are we going on walks? Do we have chronic pain and inflammation? Why do we have all of that? But all of that is stressful all at the same time. Are we overdoing it on the caffeine? What is our relationships like? Are we the person who takes care of everything for everyone else and maybe we don't do a great job at caring for ourselves? That is a stressor. Do you have a way to manage stress? Have you been through a lot of trauma? Are you stuck in chronic nervous system dysregulation, trauma-based patterns? Are you chronically people-pleasing and over-giving of yourself? How do you fill up your cup? Is your cup full? Are you consistently giving from an empty cup? All of these things are stressors. And so I think we just need to expand this definition of what stress is. And when we look at, I like to think about a bucket. We all have a bucket. By the way, all of our buckets are different sizes too. You may have a teeny tiny bucket, in which case you overfill really quickly. You may have a giant bucket, in which case you can handle a whole bunch and not feel super stressed. And your body may not feel super stressed. And that's amazing. And you might be somewhere in between. We can also change the size of our buckets, by the way, and I'll talk about that here in a sec. But, if we're putting all of these stressors inside of this bucket, at some point it's going to start to overflow. And when it starts to overflow is when we'll start to see these issues. And this is really where the mast cell issues can come into play, is when we're throwing all of these things in our bucket and our bucket is constantly overfilled and overflowing because our body cannot keep up, cannot handle all of this. This is when we look at stress and mast cell issues, this is really the way I like to look at it is, okay, what are all of the stressors that are going on right now? And what, especially when things started, like what was that moment, that period of time and things kind of started? And once again, we'll often see a significant increase in stress around that time and stress. It could be one or many of these variety of things that can happen here. When we start to decrease our stress and really do this systemically inside of our body, really caring for our liver, really caring for like hydration levels, getting all of our nutrients, getting proper sleep, that piece alone can help our bucket become a little bit bigger. One, it's taking things out of our bucket and it can give us more capacity within our bucket itself. I'll also say, for me specifically, and, I've been in this industry for over a decade. So even when I had all my chronic issues, I had a really solid foundation I was coming in from. And the nervous system piece and the trauma healing piece, that is the real way, in my opinion, to really increase the size of your bucket. As I do deeper and deeper healing work and really make potentially some tough choices, if I look at my life last year and all of the changes and all of the shifts of leaving a marriage, selling a house, like leaving my life, leaving the place I had lived for essentially my entire adult life, leaving the people that I was around, that was very stressful. And I'll tell you that my bucket got a lot bigger when I left and when my situation, when I made the tough decisions to make a lot of these changes. And my bucket, if I look from now, I'm almost coming up on a year since I left, which is crazy, and just wild to look at my last year. But if I look at kind of where I feel like how big my bucket was last year, coming at, last June when I left versus where it is now, my bucket's definitely way bigger. And I feel like well, not perfect, feel like my body's very much handled the stress of, all of our current situations and with my partner and the cancer, we're going through a lot of business shifts right now and changes and all that kind of stuff, which is amazing and great. And yes, it is also quite stressful. And there's just a lot going on, a lot of moving pieces. And I can handle it. My body, I'm not going into crazy cortisol dysregulation type issues. I don't feel this internal sense of doom or crazy sense of overwhelm or crazy sense of anxiety. My sleep largely is still really, really, really good. And that doesn't mean I don't have an occasional night where it's maybe not the best for some reason. And I think that's totally normal and totally natural to happen every once in a while. And it's not a regular thing that happens for me. And so that's a huge thing, with all this stuff going on, my thyroid. I'm not having any thyroid issues from, chronic fatigue issues to the cognitive issues, hair loss, like none of that is happening, which once again, with a history of autoimmunity, history of thyroid issues, pretty amazing that none of that has flared up. And once again, I've got some, I would consider mild hormone imbalances. They're not crazy. And I can tell they're off and they're not the best. My progesterone is just a little bit lower than feels good for me. And that is definitely playing a role in my overall health. And I can feel it, especially in the second half of my cycle. And if that's really the only thing, I'm like pretty okay with it. And it's not the biggest deal for me. And that's because my bucket is much larger than it used to be. And I just have so much more capacity for quote unquote stress. And so, yeah, what for me, like the more someone regulates their nervous system, the bigger the bucket is. And so that's a real tool and strategy to help increase the capacity of your bucket. So mast cell issues triggered by stress. When we think about the stress, we think about the whole bucket and everything that's going into the bucket, and then also the size of your personal bucket. So those are all some things to think about. So then when we get into the histamine piece, so how does this relate? Well, when mast cells are chronically turned on, chronically dysregulated, they will often start producing histamine and high levels of histamine, which is why when we think about histamine issues, one of the first things I always dig into, especially from a symptom perspective, is, okay, is this really just from a mast cell issue that's then triggering histamine issues? And we really need to stabilize the mast cells to address the histamine issues versus looking at the histamine issues alone. And that is a crucial piece that most people who are talking about chronic histamine issues do not understand and are severely missing the boat when it comes to helping people heal from these histamine-related issues. Now, just because you have histamine issues does not mean you have mast cell issues. And it is the first place I would recommend starting, especially if you have a bunch of chronic type issues. Let's rule out the mast cell issues. And then if we decide that there are mast cell issues, okay, looking at the bigger picture, why do we have mast cell issues in the first place? And when we look at all of this, mold needs to be ruled out first and foremost. Not saying mold is the only root cause of this. And if mold is present, mycotoxins are present within the body, nothing else matters until we get rid of that. And feel free to go back and listen to our 3-part mold episode or get the masterclass because I do dive a lot more into this mold piece, which once again, I'm not going to really touch on this other than we need to rule that in or out first. So mast cell issues, MCAS, definitely play a big role in histamine issues. We can also just have an overload of histamine-related issues, meaning our body's producing too much histamine for whatever reason. And I'll say the biggest reason I often see with this is gut overgrowth issues, specifically parasite overgrowth issues. And once again, really important to understand, And I'm going to breeze over this just really quickly. We've done 2 episodes on parasites. Go listen to those if you want to dig a little bit more into this. But parasites are known to really dysregulate and start to produce and increase histamine and histamine-related type symptoms. This was the big thing for me, is my parasite load was crazy high and missed because most people don't know how to test for it. Stool testing, blood testing, direct blood testing, not great ways to look at parasites. We really want to look at the differential part of a CBC and look at the monocytes, eosinophils, and basophils to look at parasite load. And even that is not perfect. There is no, in all of my education and practice, there's no perfect way to look at parasites. Symptoms also can go a long way when we look at this. So parasites can be a really, really big one here. Another big piece is a lack of DAO. So DAO is something that our body naturally produces, and DAO breaks down histamine. It's a big thing that it does. And you can find DAO in a variety of things. The most common thing that we'll often see it in is kidney. So if you think about like a beef kidney type supplements, bovine, bovine, which is beef, bovine kidney, these are the primary DAO supplements that are typically recommended. A lot of people come to us on kidney because they're like, this is going to break down all my histamine. I'm like, yes, and there might be some other stuff going on that we might want to look at. Not that that's bad. It can absolutely help, especially if you have some seasonal allergies. DAO, just a little extra DAO can go a long way for a lot of people. Very natural. And it's, some people only need that for a short period of time, and then they don't have to worry about allergy meds or anything like that. Just take some kidney for a few weeks and be good to go. And the lack of DAO, once again, the question is, okay, but why are we not producing enough DAO? Or are we overproducing histamine and also not producing enough DAO, in which case we can have a very high histamine load, and we need to look at nutrient deficiencies and why nutrient deficiencies and gut overgrowths and all these other things. The other important thing to understand when it comes to histamine levels and histamine in general is estrogen and histamine attach to the same receptors. So there's a lot of people talking about histamine levels, mental and emotional health when it comes to histamine levels in regards to our menstrual cycles. And this is really specifically for menstruating women. Well, let's for sure add in perimenopausal type women because we can see histamine issues increase also during perimenopause. And this is for a few different reasons, and there's a few different mechanisms, and largely it depends on the person as to why this is happening, especially when it increases and gets worse during perimenopause. And just doing hormone work during perimenopause because of histamine levels, once again, like we're missing the bigger picture here. So if we have estrogen dominance, and I use that term pretty loosely here because estrogen dominance is actually not as common as you might think. And when we actually do testing, blood testing is not good for hormones. It is not good. I would never recommend anyone do anything especially from an estrogen standpoint and trying to detox or lower estrogen levels just based on blood work. That is a huge mistake because estrogen and progesterone levels especially change so much day to day, week to week, hour by hour, minute by minute. And just looking at a moment in time, which is what blood work is not an accurate measure when it comes to sex hormones, especially in menstruating women. So estrogen dominance, meaning that is a true estrogen dominance, meaning that progesterone looks good, testosterone looks good, and it is really just estrogen that is significantly high and not being, we'll say, detoxed or metabolized out of the body appropriately. And the question here is, okay, or is our body producing too much estrogen? Which is something else to look at. Why is our body producing too much estrogen? It's definitely trying to fix something. The question is why and what. And or are we not metabolizing and or detoxing, depending on the verbiage you would like to use, enough of the estrogen out? There's also many varieties of estrogen pathways, which is where some of the functional medicine testing is so valuable when it comes to sex hormones and sex hormone metabolites. If we think about something like the Dutch test, which is a urine test, It's either an all month or an all day test. So we get a really, really solid view of hormone levels and really truly where they are. And also, excuse me, how they're being metabolized. Because not all estrogen metabolism pathways are ideal. There are some non-ideal ones and some ones that can be a little bit more dangerous and can trigger some issues. And we do know that there is a one specific pathway that is known to turn on and contribute to estrogen-based breast cancer. And so we can kind of see that, and that cancer is very, very complex. And we do know this pathway, this one specific pathway that does show up in the Dutch test, can be very dangerous. And so we need to understand estrogen levels. Do we have true estrogen dominance, and or do we have estrogen just going through the wrong pathways, which can also trigger some histamine type issues? Or what is actually more common, and this is why it's so dangerous to mess with your hormones. And I see too many people in the quote unquote health space, and this is largely people who are uneducated in the functional medicine space, especially in the functional testing space, recommend DIM, DIM, which is known to help support extra estrogen out of the body. And here's the thing. If you present with estrogen dominant symptoms, one of the big ones is breast tenderness, which is pretty darn common when it comes to menstruating women. It actually may not be an estrogen dominance issue. It may actually be just a lowered progesterone issue that can then lead to symptoms of estrogen dominance because the ratio of estrogen to progesterone is way off. And so you're presenting as estrogen dominant, even though you actually, when we test, you are not. And if we do use something like DIM when we're not actually truly estrogen dominant, now we're decreasing our estrogen too, and then our hormones are going to be really low, and that is very stressful on the body, and that can be very challenging to come back from. And and once again, I say this as someone who's just seen too many people injured by people who are not super well educated, especially when it comes to hormones, be put on something like DIM in particular, and they shouldn't be, and they've been hurt as a result of that. So just be very, very, very careful and make sure you get the proper testing done before supplementing with anything that can really directly mess with your hormones. If you are also doing any sort of hormone supplementation, please start really low, really slow, and make sure you're checking in regularly with whoever you're working with, because hormones are very sensitive. And once again, I was in perimenopause before the age of 30 and was able to reverse myself naturally out of that. And it's not fun. You do not want to be messing with your hormones in a way that's not actually supportive of your body. So just be very careful with that. So when we think about common histamine symptoms, there's quite a few here. You know, the sneezing, the nasal congestion, sinus pressure, sinus headache, headaches and migraines, rashes, hives, eczema, psoriasis, the itching, the flushing, difficulty breathing, things like that. Now, then we also can think of a lot of less obvious type symptoms that get into kind of really overlap here with the mast cell issues. And once again, I am going to get into this hormone piece, continue to get into this hormone piece a little bit deeper here, going over these symptoms. So less obvious symptoms that can still present as histamine-related type symptoms: bloating, abdominal pain, bowel movement issues, gas, nausea, vomiting, anxiety, depression, OCD, irritability, dizziness, blood pressure issues, especially the low blood pressure, heart palpitations, irregular heartbeats, fatigue, sleep issues, joint pain, and then hormonal shifts that can present as something like PMDD, especially like increased irritability within your cycle, especially in the second half of your cycle, just a lot of irritability, a lot of people almost feeling like, you feel like pretty decent during the first half of your cycle, and then you're turned into a totally different person in the second half of your cycle. Usually about 7 to 14 days before the start of your period is kind of usually what this looks like. And this is where a lot of people are coming in with the histamine related issues, where if you feel like this other person with PMDD and you just like take a Zyrtec or take an Allegra, this is the way to fix it, and you notice all your symptoms go away. Cool. It's a great test to understand, okay, is this playing a role? Is histamine and histamine overload, is this playing a role in a lot of the mental and emotional hormonal type shifts that are going on, which is great to know. Once again, great to know. Easy test, pop in an allergy pill. Do you notice a difference? If you do notice a significant difference, yes, you can absolutely, once again, your choice, symptom manage with allergy medication for the whole time, for just part of your cycle, whatever you feel called to. And you're symptom managing, which once again, like if that is what you would like to do, like that is totally your call. And, that's not what we do. And that really isn't what holistic health and functional medicine is supposed to do in my perspective. And by the way, I see a ton of practitioners in the holistic health space symptom managing this particular issue, but using histamine DAO type supplementation. And here's where my opinion really differs and how our approach when it comes to health really differs is, in our opinion, there really should not be a lot of supplements that you're on long term. We are big fans of, some sort of multivitamin long term. Outside of that, if you don't have a gallbladder, you definitely need to be on some ox bile for bile support. And really, it shouldn't be much else. This is where the blood work comes into play here, kind of as a maintenance standpoint. And, every 6 to 12 months, checking in on your labs. What's going on? What are the labs showing? Do you need maybe a little extra support somewhere? For me, that might be, I was injured many years ago by a functional health practitioner with my iron levels, and I was still largely dealing with those. Even last year, they were finally in an okay place, not where I'd like them to be, but finally in an okay place. And it had been, I don't know, five years at that point. And outside of that, like everything is pretty good. And like if we need a supplement here and there, magnesium, probably not a bad idea for most people. And if you're eating a magnesium-rich diet and managing your stress and your adrenal health, do you really need it? Having some support when you do go through heightened periods of stress, especially uncontrollable stress. No, not a bad idea. I added in adrenal cocktails that are very supportive for the adrenals. I think that's really helpful. I am taking magnesium glycinate because I feel like that does help me relax. And I take some reishi. I do like lion's mane to help with cognitive function. I don't really take it every day anymore. Take it a few times a week, and no, that's not the most ideal. And I feel like my brain is still in a pretty good spot. And I do start to use it more regularly when I feel a little bit foggy and maybe stress is a little bit higher. Maybe in the second half of my cycle when I feel my progesterone dropping more than feels good for me. Yeah, a little extra support here and there, but on a routine basis, no. My body responds pretty well because I've done this bigger work, and I do, liver support a couple times a week. I manage my stress and do nervous system regulation. I eat pretty well. I sleep pretty well most of the time. I hydrate pretty well most of the time. I'm doing all of these things, and that's really what it's supposed to look like. So if you are having to take supplements for extended periods of time, why? Are you being symptom managed? And what else is going on? Why do you have to be on these? What is still going on in your body that you need these things? And once again, if you choose to stay on these things, that is totally fine. And if you don't want to, there are other options here. And this is really the histamine piece that bothers me, is people are just willy-nilly take DAO, take something that's going to manage your overall histamine levels, whether that's homeopathic and or nutrient based supplements. And I'm not a huge fan. And this is not people who are trying to represent themselves as root cause healers, as holistic health healers. This is not holistic health. That is not holistic healing. That is symptom managing in just a little bit of a different way, that maybe it's not medication, and just you're having to still spend money on the supplement to manage this issue versus looking bigger picture. Why do we still have this issue? So when it comes to histamine issues, once again, I like to look, one, is there a mast cell piece? Two, okay, what else is going on within the body? Toxin overload, definitely a big piece and a huge contributor to mast cell and histamine issues. And that might be mold, heavy metals, and or environmental toxins. Mold absolutely should be ruled in or out first. That it's such a big one and it is so often missed. Then I would look at gut health, especially parasites. And once again, stool testing, not a great way. A direct blood test for parasites, not a great way here. We want to look at monocytes, eosinophils, and basophils in the differential part of the CBC, couple that with symptoms to look at parasite load. Then we can start looking at some of the other things. I'll tell you that 99+% of the time, we're dealing with toxin overload issues and or gut overgrowth issues, often both. And once we address those, then we no longer have the hormone, the histamine, the mast cell, all the other stuff. It just goes away because the body is in a better place where it can heal and once again stay healed long term. So I think that is everything when it comes to mast cell and histamine. It's a really good overview and starting place here. Thank you for listening. As always, please like, subscribe, follow. If it resonates, 5-star reviews really, really, really mean the world to us. Thank you for listening, and I hope to see you next time. Bye.